Good afternoon, this is Jody Norton. I'm the RC Hospice Director of Patient Care Services.
Hey, I'm Tom Rupp. I'm the chaplain. Been with RC Hospice for 5 years now.
I'm Kelsey Murchison. I am an admissions and case manager nurse.
Hi, I'm Nadia Andre. I'm an LVN, been with this hospice agency for 5 years now.
So RC Hospice is a team approach to nursing and clinical services that encompasses nurses, social workers, chaplains, hospice aides, and volunteers, all led by our medical director. We specialize in patient and symptom management as well as family support, and Tom will tell you a little bit about spiritual care.
One of the things I really like and have liked for many years working here at RC is, and it all with C's, core, competent, compassionate group of people who care. And to me, this is expressed through nursing, through the home health aide, through the social worker, through the chaplain, through the director, through everybody. That we as a team focus our concern and care on the hospice patient as well as their family and friends who surround them. So it's a great concept and it works, and very much glad to be a part of this team.
Besides the team, one of the things that hospices provide is all the supplies that a patient and family would need, as well as any medical equipment that they would need, as well as medications that are covered for the symptom management and for their diagnosis. So in light of this new pandemic, COVID-19, we are all taking significant precautions. We are considered an essential healthcare provider, and so we will continue to see our patients and families, but with precautions. We are screening our patients and our staff to ensure that they're not had a fever and they're not having an active cough. We're all wearing protective medical equipment so that we're not exposing our patients, and washing our hands and wearing gloves much more than on a day-to-day basis between patients, between contacts with families, just being extremely cautious.
So how the admission process works is first we contact the patient and the family and verify that they don't have any COVID-19 symptoms, as well as let them know that we do not. When we get there, we make sure to wash or sanitize our hands prior to going in. We wear our gloves, use protective equipment to basically prevent any contamination of equipment, as well as just to keep the patient safe. And
During these times, we provide educational material to the patient, to the staff that takes care of the patient, and to their family to be safe, and we're checking daily on their health status if somebody got contacted, or we have to take precautions.
for example, if a patient newly develops a cough or a fever, we make sure to notify the doctor as well as our clinical manager, which is Jody.
And we're updating our policies on a daily basis from CDC input and from the California Health Department, and keeping our families and patients and staff all very well informed.
And even though we consider the chaplain part of the team, in the flow of responsibility, I'm not always as necessary or needed. So therefore, there are times when either A, I'm not going to enter a facility, or B, where I have to also answer their questions, have my temperature taken, wash my hands, wear a mask. This has happened. So one of the good things about this for me is it has kind of changed the way I do the chaplaincy with our patients, using the phone a whole lot more often to speak to patients and or family members who are able to talk. So it's a good thing for me until that time I can go back and start visiting regularly face to face.
And one thing has been changed. We used to chart our visits in their homes or in the place we take care of our patients. Today, I was told, please do your charting in an office. So I said, oh, no problem. We have been doing that, and for these times, we will continue until we get back to normal.
So in these trying times, as we go about to various facilities, and most specifically the RCFEs, sometimes some of the administrators seem to be having a difficult time getting supplies, most especially, say, toilet paper, towels, milk, eggs. And I happened to be visiting one of the places where the administrator feeling quite frustrated and almost in tears, was telling me how that they only allow her but 1 gallon of milk per visit, and she has 2 homes with 6 residents each, and that's 12. And she said she goes to a gallon a day. Well, I went back to the office here and then also home, and I had an idea and posted on social media platforms, several of them, in gist, this problem, this challenge, and probably 20 or 25 of my neighbors and friends responded. Nothing major, just a little bit here, a little bit there, with these very items. And it was so cool the next day to show back up. I think I had 6 or 8 gallons for this one person. Had enough to go to 4 different facilities and drop off various items that they needed. It's a very good thing, and it shows the teamwork and working together, everybody doing their part. And so I was just a delivery boy. That's all I was. But it was good that I could do that. I felt good, of course, doing it, but more importantly, not only for the administrator, but especially also for the residents. It was a good thing, and so I was glad to be a part of that. If you perhaps are feeling interested or the need for the services of RC Hospice, we would invite you, please, to call us here at the office at 916-858-1440. You'll get to speak to Jody or to Kelsey. They're here in the office, and they'll gladly answer your questions and set you up, if possible, if needed, on this hospice journey. Thank you very much. Very nice talking with you.
And we're happy to provide any informational visits as well as information on COVID-19 at any time, again at 916-858-1440. Thank you.